pain. We call it Lyrica, pregabalin. And 2 serotonin and norepinephrine reuptake inhibitors are also improved. Now, because it's available in this country, I'll concentrate some on pregabalin. 3 studies, 2 of them quite short-term, have shown significant improvement, and most of the improvement is in pain. What about the dose and starting treatment? Let's remember that this widely disseminated result of studies shows rather high doses. The white line you see is top line's the placebo. The other doses were 300, 450, and 600 milligrams a day, which are really quite high, and 600 milligrams a day is really too much. So in treatment, we urge using the smallest effective dose. Consider the dose-dependent adverse reactions. Warn the patient. Don't take your first dose of the drug and then go out driving. You may be sleepy, dizzy, weight gain's a possibility. Recommended starting dose is, some people use 75 a day, some 75 BID, with 450 as your top dose. It has to be discontinued gradually if it's stopped. You have to adjust the dose down for limited creatinine clearance and give a supplement after hemodialysis. There are many warnings and precautions, and in order to review all of those, you really need to read, you need to get a copy of the drug insert, which is probably available on the internet, to understand all of these. So in patients with diffuse arthralgia and myalgia, think of inflammatory rheumatic syndrome, endocrine abnormality, drug or toxic reactions. Don't forget polymyalgia rheumatica. I see that in the older patient. Think about soft tissue, fibromyalgia, depression, and somatoform pain disorder. The classic rheumatic diseases have objective abnormalities on exam or lab. Symptoms of muscle pain or weakness, that's different. You know, if the patient can't stand up out of a chair and cannot raise their arms, think about something different, inflammatory muscle disease. And we now can screen and actually treat some of the common treatable mental disorders. And Mr. Chair, I'm sure that I have gone over, but if I could ask just for a few more minutes.
No, you're doing fine, sir.
Oh, thank you. Oh, you're too kind. For demonstration of the trigger points. Now, I've asked for a representative of the company that makes pregabalin. Is he in the room? This is a gentleman who helped us, who really has helped us enormously, helped me a lot in coming into this country and being sure that I'm settled and safe. He was with us in Lahore, very helpful there. And actually in Lahore, we examined Mr. Faisal before a group, and I'm happy to say he does not have fibromyalgia. And you should be happy too. And now we want to ask for one of Lahore's upcoming young rheumatologists at FMH, about to take his board exams, which I predict he'll pass with no difficulty.
Yeah.
Is this good to see, or should I have them stand down here to show you the tender point? You want on the stage? Okay, now I'm going to leave. Okay, Dr. Shea.
So I will start off with the neck.
Going to demonstrate
Most of the tender points are behind the neck. So the first one is,
Can you bring him something to talk about?
okay, so I can turn him around and can come close to the mic. Yeah.
Yeah.
I can speak loud. Okay, fine.
Okay, talk loud. See,
Sure.
this is it. This is your
So here, an occipital protuberance in the back of the neck. There are 2. So apply pressure of 4 kg, which is equivalent to the fact that your nails should get blanched. So then you should look for on the upper border of the trapezius on the base of the neck. So of pressures, you may have to come here.
Yeah.
So over here,
Two hands, use one hand and everybody will be able to see it.
so here,
Use the left hand.
okay. So I am the right-hander, so I doubt I would be able to do it.
Really important.
At the spinous process, medial border of the scapula, the interscapular region, over here, so bilaterally, over here, then at the SI area, again with the thumb.
Right above the pelvic rim.
If you turn around now, so the second intercostal space, 2 centimeter distal to the lateral epicondyle, apply again, pressure of 4 kg approximately, flexing the elbow and then applying pressure over here. One another point, the straighter trochanter, the bump of the hip, again, here, so, and then 2 centimeter above the medial joint line, knee in the medial fat pad.
Yeah.
This will come out to be 18 in number. And if you have 11 out of 18, you, by ACR criteria, your patient would have fibromyalgia.
11 out of 18 by the published criteria. I think we've all made the diagnosis in a case that seems true, that seems to fit, but doesn't have quite 11. Thank you. It's in the hand. Beautiful. It is great. Thank you so much.